Developing story, thousands of nurses across the county, they are preparing to strike. Within just the last few hours, they voted to authorize that strike. It could happen within 2 weeks. 10's reporter Jeff Lasky has been digging into what this could mean for patients or anyone who needs to go to the hospital. Jeff.
Yeah, Steve, it means that even though there has been a vote taken to strike, it does not mean there will be a strike. And if the nurses do end up leaving here from Sharp Chula Vista or any of the other facilities around the county, they actually have to give Sharp 10 days notice before they strike. Well, I talked to the folks at Sharp and found out a lot would happen in those 10 days.
1, 2, 3.
This evening, Sharp nurses are celebrating their solidarity. When all the ballots were counted, 98% of union members voted to authorize a strike.
But it's definitely not the outcome we were looking for.
Sharp Vice President Dan Gross told me he began his career as a nurse. He's still optimistic a deal will be reached.
We believe in our nurses. They are great, they're wonderful, and we are going to have continued conversations in an attempt to avoid a strike.
But Gross knows a strike could happen. He told me Sharp has already hired a temp agency which specializes in nurses who fill in during a strike.
So they're used to needing to be flexible. They're very versatile in terms of being able to learn new organizations.
One of the nurses they'd be replacing is Naisha White. The longtime Sharp Mary Birch nurse voted to authorize the strike. She says because Sharp pays less than hospitals like Kaiser and UCSD, Sharp can't keep too many good nurses from leaving. Nurses like White are stuck working overtime and skipping breaks.
Constantly short-staffed. Our patients never see it, but the nurses feel the strain. The staff feels the strain, and it's hard.
Sharp has offered raises of at least 16% over 3 years, but the union says it's not enough to keep nurses from leaving. So a strike might be hard, but you can tell from their cheers the nurses feel it's the right thing to do.
In the short run, it's going to be hard, but it's necessary.
Both sides have shared some optimism with me. That's because we've been here before. There have been 2 occasions in the past where nurses have authorized a strike, but both times a deal was made before a strike ended up happening. Now, if you do have an elective surgery coming up, that 10-day notice would help give you some time to be able to talk to your doctor, decide whether to put that off or go ahead with it. Live in Chula Vista, Jeff Lasky, 10 News.